The race to free a child after Israeli shelling in central Gaza. The rescuers' efforts were in vain. The child, another casualty of the conflict. Other Gazans have heeded warnings and fled south after Israel issued an evacuation order for more than 1 million residents of northern Gaza. Families are taking shelter at United Nations schools. Many traumatized from the journey.
We're living under stress. We haven't seen anything like this before. It's huge, a massive danger. Children, as you can see, where should we take them? Especially today when we fled our house. We saw burnt-out cars along the way. Thank God we're safe and that we've reached the south.
Near Gaza's border with Israel, Israeli forces are assembled for a ground incursion. Israel has vowed to destroy the Palestinian Hamas militia after its unprecedented terror attacks on southern Israel. But Hamas has taken hostages into Gaza, complicating Israel's invasion plans. On Saturday, the Israeli army said it had recovered the bodies of hostages killed just inside the Gaza Strip perimeter.
We need to be very delicate around this issue. We are concerned about the hostages. We are continually working in order to identify, and the process of identifying bodies that have been mutilated and burned is very tedious and very timely. I want to be respectful to them. Yes, of course, we did say yesterday that there were Israelis retrieved in the ground operations.
Israel has vowed to uphold its complete siege of Gaza until all hostages are freed.
Pope Francis has called for humanitarian corridors to help those under siege in Gaza. The Pope's appeal comes as Israel readies its troops for a ground assault in retaliation for unprecedented attacks it suffered a week ago, as we have heard. Now, Pope Francis has also renewed his call for the release of the hostages kidnapped by Hamas militants.
I am again appealing for the release of the hostages. And I strongly urge that children, the sick, the elderly, women, and all civilians should not fall victim to the conflict. Humanitarian law must be respected, especially in Gaza, where it is urgent and necessary to guarantee humanitarian corridors and help the population.
Ahmed Al-Mandari is the World Health Organization's regional director for the Eastern Mediterranean, and I asked him how far it has been possible in these days to evacuate patients.
Answering your question, I'd like us to share with you numbers. There are around 22 hospitals in that area in which Israel asked them to be evacuated, hosting around 2,000 patients. Many of them are on ventilators. Many of them are on regular 24 hours, medications like cancer therapy, renal dialysis. Unfortunately, this represents around 61% of the bed capacities in the whole of Gaza. The other hospitals on the other side, in which they were pushed to move, are already full, 99.9% full capacity. There are no ICU beds. There are no beds in the ordinary wards. Operation theaters are fully working 24 hours with a severe shortage of supplies. There's a shortage of water and electricity in the coming few hours, if no solution is coming out. In addition to that, Claire, I'd like us to share that there are around 120,000 people in Gaza Strip, suffering from different types of chronic illnesses, like, 52,000 of them, 52,000 patients with diabetes. There are around 25 pregnant women, in which 180 deliveries a day. So it means that we are really putting death sentence to those group of people who are in need of that service in every second of the hour.
So it's not just in hospitals, but also health concerns for people across the Gaza Strip. I want to look at aid from the WHO. Yesterday, your organization has told us that it sent a plane load of supplies that is now sitting in Egypt waiting to get into Gaza. Do you think that we are close to an agreement that will allow those supplies to finally cross into Gaza?
This is what we are hoping, to get in the coming few hours based on whatever negotiations our Director General, Dr. Tedros, is making, and also my counterpart, Hans Klogen, from the regional director, of Europe. in addition to the other political leaders around the globe asking the Israelis, to make sure that, Rafah, for example, border nearby Egypt is open. Our supply is there in Al Arish airport, which is around 20 kilometers away from Rafah. It is there available to be shipped to Gaza. Our teams are also available in the regional office here and headquarters. There are further supplies available in our logistic hub in Dubai. We managed to secure around 3 million plus 1 million US dollars to buy these supplies. So we are available in each, the moment they tell us Rafah cross point is open, we are ready to go inside and provide the support.
So your team is ready to move in as soon as it is allowed and possible. Can you tell us a little bit more about exactly what is in those supplies that will be sent to Gaza to help people there?
These supplies included, in fact, trauma kits that can be used to treat those injured people either on streets, in the field, or in hospitals. There are kits, containing surgical kits to do operation inside the hospitals. There are medications for chronic illnesses like diabetes, hypertension. There are kits also to provide for around 300,000 people, including pregnant ladies, to provide them with the care they need inside hospitals and also in the field.
Well, thank you so much for taking the time to speak with us on DW News. We really appreciate your time today. That is the WHO's Ahmed Al-Mandharet. Many thanks.